Namaste, Teachers Couple Talk channel. First time followers, please subscribe my channel, set bell icon. Then we can make any videos, we can find as a notification. Get into the video. A menstruation cycle begins when you get your period or menstruate. This is when you shed the lining of your uterus. The cycle is part of your reproductive system and prepare your body for a possible pregnancy. A typical cycle lasts between 24 and 38 days. What is menstruation? Menstruation is the monthly shedding of the lining of your uterus. Menstruation is also known by the terms means menstrual period, menstrual cycle or period. Menstrual blood, which is partly blood and partially tissue from the inside of your uterus, flows from your uterus through your cervix and out of your body through our vagina. Menstruation is driven by hormones. Hormones are chemical messengers in your body. Your pituitary gland in your brain and your ovaries, part of your reproductive system, make and release certain hormones at a certain time during your menstruation cycle. These hormones causes the lining of your uterus to thicken. This happens so that if a pregnancy would occur, an egg can implant into your urine lining. Hormones also cause your ovaries to release an egg. The egg moves down your fallopian tubes where it was for sperm. Sperm does not fertilize the egg. Pregnancy does not occur to the lining of your uterus, break down to sheds. This is your period. What is the menstruation cycle? The menstruation cycle is a term of describe the sequence of events that occur in our body as it is prepares for the possibility of pregnancy each month. Your menstruation cycle is the time of the first day of your menstruation period until the first day of your menstruation period. Every person's cycle is slightly different, but the process is the same. How long is a normal menstruation cycle? The average length of the menstruation cycle is 28 days. However, a cycle can range in length of 21 days to about 35 days and still normal. The days between period is our menstruation cycle length. The average menstruation cycle lasts 28 days. However, cycle lasting is little as 21 days for as long as 31 days can be normal. Most people have their period for between 3 and 7 days. A period is normal if it is anywhere between 3 and 7 days, while on this shorter end of the range, some people have a menstrual period for the 3 days. This is 3 days. The rise and fall of your hormones trigger the steps in your menstruation cycle. Your hormones causes the organs of your reproductive tract to respond in certain ways. The specific events that occur during your menstruation cycle are the menses phase. The phase which is typically lasts from day 1 to 5 is the time when the lining of your uterus sheds through our vagina. Pregnancy hasn't occurred. Most people bleed for 3 to 5 days, but a period lasting only 3 days to as many as 7 days is usually not cause for worry. This phase typically takes a follicular phase. This phase typically takes place from days 6 to 14. During this time, the level of the hormone estrogen rises, which causes the lining of your uterus to grow and thicken. The addition another hormone, follicle stimulating hormone (FSH), causes follicle in your ovaries to grow during days 10 to 14. One of the developing follicle will from a fully mature egg. This ovulation, this phase occurs rightly at but day 14 in 28 days menstrual cycle. A sudden increase in another hormone, luteinizing hormone (LH), causes your ovary to release its egg. This event is ovulation. The luteal phase. This phase is last from about day to 15 to 28. Your egg leaves your ovary and begins to travel through over fallopian tubes to uterus. The level of the hormone progesterone rises to help prepare your uterine lining of pregnancy. If the egg becomes fertilized by sperm and attaches itself to your uterine ball, you becomes pregnant. If pregnancy does not occur, estrogen and progesterone levels drop on the thick lining of your uterus sheds during your period. People start menstruating at the average age of 12. However, you can begin menstruation as early as 8 years old or as late as 16 years old. Generally, most people menstruate within a few years of growing breasts and public hair. People stop menstruating at menopause, which occur at about the age of 51. At menopause, you stop producing eggs. You have reached the menopause when you have not gotten a period in an year. Some people experience symptoms of menstruation and the others do not. The initially of these symptoms can also vary. The most common symptoms is cramps. The cramp you will feel in your pelvic area is your uterus contracting to the release its lining. Other signs you are getting your period are mood changes, trouble sleeping, headache, food craving, bloating, breast to tenderness. Your menstruation cycle can change from your teen years to your 40 years or 50. When you first get your period, it's normal to have a longer cycles of. However, period flow. It can take up to 3 years for young people to have regular cycle after they begin menstruation. Normal menstrual cycle is cycle that occur roughly every 21 to 35 days, causes bleeding for between 3 and 7 days. Once you reach your 20 seconds, 20 years, your cycles becomes more constant and regular. Once your body begins transitioning to menopause, your periods will change again and become more irregular. It is also normal for your period to change during other life events that affect your hormones, such as after childbirth or when you are lactating. Irregular menstruation. Describe anything that's not a normal menstruation period. Some examples for irregular period are period that will occur less than 21 days or more than 35 days apart. Not having a period for 3 months or 90 days. Menstrual flow that will much heavier or lighter than usual. Period bleeding that lasts longer than 7 days. Period that are accompanied by severe pain, cramping, nausea for vomitings. Bleeding or stopping that happens between periods. We can expect to last between 2 and 3 tablespoons of blood during your period. Some signs of irregular period becoming are bleeding through a tampon for pad every 1-2 hours, passing blood clots larger than a quarter, bleeding longer than 7 days each time you have your period. It's normal to experience some variation in the amount of bleeding each cycle. It's also important to remember your normal may be different than some else's. Try not to compare. Talk to healthy care. Provided you can consider about irregular or severe bleeding during your period. It is a good idea to be aware your menstrual period. Not getting a period may not seem like a big deal, but an irregular period can be sign of a problem. Your healthcare provider will ask you about your most recent period and menstruation cycle. Knowing that's normal for you can be very helpful to your provider. So I will explain to the menstruation in this video. You can like this video, please share and like, give me comment as your opinion on this video. Thank you for watching one and all.
Your reproductive system is wonderfully complex, yet the signals it gives you can be quite simple, helping you identify the fertile and infertile times in your cycle. You may have noticed different types of discharge throughout your menstrual cycle. The sensation that this discharge produces at the vaginal opening, called the vulva, also changes. This is because your cervix produces different types of mucus in response to changing hormone levels. Your cycle begins with menstrual bleeding, when the lining of your uterus, called the endometrium, is shed. Following menstruation, your cervix becomes blocked by a thick plug of mucus that prevents sperm from entering the uterus. This means that you are infertile. Many women feel dry at the vulva during this time. Other women notice a pattern of discharge that feels and looks the same day after day. The number of days that you experience this unchanging pattern will determine the length of your cycle. In an average cycle, this pattern of infertility lasts for a few days. If your cycle is short, you may not experience any days of this infertile pattern. In a longer cycle, you will have more. Early in your cycle, the pituitary gland in your brain begins to secrete a hormone called follicle-stimulating hormone, or FSH. FSH stimulates the growth of a group of follicles in your ovaries. Each follicle contains an egg and a bundle of surrounding cells that secrete the hormone estrogen. Estrogen activates the cervix to produce the mucus essential for fertility. This is the start of the fertile phase. The fertile phase, shown here using a baby symbol, begins a few days before ovulation. One type of mucus produced by the cervix dissolves the plug, which means sperm can now enter the uterus. Another type of mucus filters out damaged sperm cells. Yet another type nourishes the sperm, so they can live for up to 5 days in your reproductive system. It forms channels which help the sperm travel through your reproductive system to meet and fertilize the egg. You become aware of your developing fertility by the changes in the mucus that you feel and see at the vulva. You will notice that you feel increasingly wet and then slippery, and you may see mucus that becomes thinner and clearer. The last day of the slippery feeling is called the peak of fertility. It is very close to the time of ovulation. As one follicle nears maturity, the pituitary gland is stimulated to release a surge of another hormone called luteinizing hormone, or LH. LH triggers ovulation, the release of the egg from its follicle. The egg is swept up into the fallopian tube, ready to begin its journey towards the uterus. If fertilization doesn't occur, the egg will die within a day of ovulation. But if the egg meets any sperm along the way, fertilization can take place. After ovulation, the empty follicle is transformed into the corpus luteum. The corpus luteum produces a hormone called progesterone. Progesterone prepares the endometrium in case there's a fertilized egg ready to implant. It also causes the mucus to thicken and the plug to begin forming in the cervix again. The day following the peak, you'll no longer feel wet or slippery at the vulva. By the end of 3 days after the peak, your fertility for this cycle is over. About 2 weeks after ovulation, a new cycle begins. We can now see how essential cervical mucus is for fertility. Once you're familiar with your patterns, you'll be able to identify your fertile and infertile times. This knowledge can help you to achieve or avoid pregnancy.